Hi, my name is Derek Dorado, and I'm here to show you some key features and functions on why you should take a look at AZZLY as your EHR and EMR system. First off, when I log into the system, I see my home screen. I like to look at my clients in a photo view, but I could also toggle between that and my list view here. The list view gives me more information at my fingertips, so I can still see their photograph, their name, but now I could see more information here as well in these columns, and I could customize these columns to my liking. So I could go ahead and add, if you're a residential program, adding a housing, room and bed number. If you're not a residential program, that's completely fine. Let's remove those, and let's perhaps add a primary payer and review date. Especially if you're on the administrative side, that could be very helpful, right? So we could customize these columns. Furthermore, if I go to the right-hand side of the screen, clicking the filter area, I could toggle between my own caseload, other providers' caseloads as well. I could include clients from specific programs or levels of care, or even filter through different dates of admission and housings and locations. If I click on any one of my clients here, I can see a preview of their chart. I can see their demographic information, emergency contact, any precautions, risks. Their treatment plan information would be here. Any required encounters, so these would be any due dates, any notifications or timers that are set to any workflows or any mandatory or required documentation that needs to be done for this client, including recurring due dates. I could look at their visit history, see their schedule, and even print out their schedule for them. Seeing their diagnoses, any medications, insurance, and much, much more right from this screen. Moving on down, we have a wonderful calendar and scheduling functionality built into the system. I personally like to look at not just my own calendar, but also other providers' calendars that I'm assigned to. One click, I could create an individual session or a group session. An individual session can be done very easily by selecting the client, the appointment type itself. We like to tie the CPT codes to the appointment types as well for billing purposes. We can make this a telehealth meeting in one click. We do have Zoom meetings integrated within the application, and hit create. As that appointment is being put on our calendar, I'll share with you, we do have automated appointment reminders built into the application via text, phone call, and email. One click on the appointment type and we can launch into the Zoom meeting or launch right into that defined encounter. And a defined encounter is a workflow that's already been predetermined. We know exactly the assessments that need to be done for this documentation, as well as the progress notes, treatment plans, and even a UA section in here. It's already spelled out by my supervisors. I cannot make a mistake doing this workflow. Going back into the calendar, we could also do group notes. We'll select the time slot and create a group appointment. We could drop clients in one by one. Most of our customers like to drop in an entire roster. Selecting the appointment type, being a mental health group, knows it's an hour long. Again, we can make this a Zoom meeting. We could also make this a recurring group. So if this is a group that meets every Monday, Wednesday, and Friday, we could go ahead and schedule that out, hit create, and now that's going to drop into our calendar. One click, we could jump into the check-in feature, and we're going to see our clients listed out here. We could uncheck the folks that are not in attendance today, hit check in, and it's going to automatically bring me to the general group note area, where now I could do my general group note as well as my individualized group notes right from here. The last two modules within AZZLY that I'd like to talk about is the My Work area, which allows you to see your list of incomplete documentation in chronological order. So that substance use disorder assessment that we were just working on for Ben is right here. And I have it organized to show me my individual sessions and then my group sessions in chronological order here. As a supervisor, not only can I look at my own incomplete documentation, but also other staff members' incomplete documentation. Hit apply, and now I'm going to see their incomplete documentation from this screen. I could open documentation up and actually complete it from this area as well. So very helpful for clinicians, therapists, or any group facilitators that need to get documentation done. They could do it right from this screen, not having to go back into the calendar or back into the client's chart. Just in one list view, they could go ahead and see their incomplete documentation and get it done. Lastly, this required encounter area allows you to go ahead and see all of your incomplete documentation that's required and mandatory to be done. So for instance, treatment plan reviews, typically 30-day cycles. So from 30, 29, 28, 27, it's going to count on down until it's past due. Same thing, biopsychosocials. You have 72 hours to get them done. It's going to count down. And also for releases of information, typically have to be reviewed every 6 months. You could set those timers up and it's going to be counting down for you. So between this required encounter area and this my work area, your staff is going to know exactly the documentation that needs to be done, and they're going to be able to get it done on a timely basis. Thank you for taking a look at AZZLY. Again, my name is Derek Dorado. Looking forward to the next step with you.